Our next speaker is Dr. Alfred Gellhorn. He's a clinical assistant professor at the Department of Rehabilitation Medicine at the University of Washington in Seattle. He received his medical degree at Pennsylvania at his internship and residency at University of Washington in Seattle. Then he left to do a fellowship in orthopedics and sports medicine, and then came back to Washington. He's been now chosen to be head of sports medicine at HSS Cornell, and he's going to talk about what's new in spinal osteoarthritis.
All right. Well, thank you very much, Dr. McLean, for inviting me to be here. Thanks to all the other presenters that have talked so far. This has really been a wonderful conference, and thanks to all of you for being here and for your attention. I'm one of the non-rheumatology interlopers here, and I'm probably learning more than anyone else. I have to say, my first reaction when I see a rash is to turn and run as quickly as I can in the other direction. So I'm very grateful to have colleagues like you I can refer to. I don't have a formal disclosure slide, but if I did, it would say that I got 0 out of 12 right on the dermatology lecture yesterday. Anyway, I thought we'd spend some time talking about where our fields do overlap, and I think one of the biggest areas is probably in osteoarthritis, which I see very frequently, and I suspect that you do as well, and specifically we'll talk about osteoarthritis involving the spine. Has anyone played with this tool on Google? This is called Google Ngram Viewer. Does anyone? Show of hands. Yeah, one person. You know then that this is a spectacular way to waste your time. It is, as you see, you can sort of type in your word or your phrase, and then what pops up is a graph of the amount that has been mentioned and published in the entire corpus of English, at least that which Google has access to, which is pretty much everything. And so I thought I would look at some of the things that we're going to talk about today. So low back pain certainly has gotten a big bump in interest since the 1970s. Osteoarthritis similarly is very well written about, especially since the 50s, even more so than low back pain. Things that are suggested to cause low back pain, such as the lumbar discs, they have certainly have been written about, and amazingly and sadly, I think, for us, is that the lumbar facet joints really have received very little attention in the literature since being discovered many hundreds of years ago. If you zoom in on this, so if you take away the big dogs here, osteoarthritis, back pain, and the lumbar discs, and you zoom in on the facet joints themselves, you do see that there has been an increase in what has been written and thought about these in the last 20 years or so. So we will have some things to talk about. Don't fear. Here's the objectives for today. First, I want us to all sort of be comfortable with the definition of what spine osteoarthritis is, and more importantly, some of the advances that we have in identifying what I would consider to be symptomatic spine osteoarthritis. I'm going to talk about the very troubling term, to me, nonspecific low back pain, and sort of some of the progress that we've had over the last few years in sorting through this. A lot of that is going to be imaging stuff, so we'll look at a bunch of pictures that are relevant to spine OA, talk about some epidemiology, risk factors, and correlates, and then finally we're going to talk about clinical manifestations and our current treatment options for spine OA. So let's start with this. I think more than anyone else that I talk to, you are very aware of the first statement here, which is that osteoarthritis is a disease of synovial joints. That goes without saying. In the spine, clearly the only true synovial joints that exist are the facet joints. A lot of people will lump the spine osteoarthritis, spine arthritis, in with disc degeneration, and that's not completely unreasonable, but I would make a case that they should be distinguished from one another. If you look at the sort of the pantheon of back pain and all of the reasons that people have back pain, and just to prove that I was listening yesterday at the thieves market, I will now include in this macrophage activation syndrome, which was not part of my differential diagnosis until yesterday. But certainly, a large part of this is degenerative, right? So we have the acute back pain, the sprains and strains, and then we have the degenerative part of this, which is largely taken up by facet joint osteoarthritis and disc degeneration. The Venn diagram here, I think, is accurate, that they